Let's talk about the cardiac depressants like the calcium channel blockers. I'm going to use two prototypical calcium channel blockers, one from each class, and explain how they work. First, there's verapamil, which is a non-dihydropyridine calcium channel blocker, and there is nifedipine, which is a dihydropyridine calcium channel blocker. Now, the nifedipine will block L-type calcium channels. In the case of nifedipine, it causes vasodilation peripherally. In the case of verapamil, it causes vasodilation peripherally as well as cardiac suppression in the way that the heart is beating. So there's less inotropy and less chronotropy. Now, side effects of these particular agents are constipation, pretibial edema, nausea, flushing, and dizziness. Toxicity includes AV blocks, so you can have sinus node depression, AV block, and this is usually from verapamil, which has the most activity at the heart. Other cardiac depressants can be beta blockers. So you talk about propranolol as the prototypical drug, and I've already mentioned beta blockers multiple times in previous lectures. Beta blockers reduce heart rate, cardiac force, and blood pressure, and it's used in prevention only of angina. It is not for treating acute angina attacks. Remember that vasospastic forms of angina do not respond well to beta blockers. What beta blockers do is just reduce the oxygen demand that the heart is asking for. Let's talk about metabolic rate modifiers. These are relatively new agents. They are partial fatty acid oxidase inhibitors, or PFOX inhibitors. These increase the efficiency of oxygen utilization by the myocardium. It shifts the energy production from fatty acids to glucose. It may also have an effect on slow sodium channels in the heart. We're not entirely sure, but we do see a reduced heart rate, reduced contractile force, and we think, and in some studies it has shown, that we have less intracellular calcium, which is why we think it may work on calcium channels. We also have slow calcium channel inhibitors. These are specific to one type of calcium channel that is called the slow calcium channel. This inhibits the sinoatrial node as well. It is a selective reducer of heart rate without actually reducing the other parameters like strength of contraction. This is an investigational drug. We expect to see information on this drug at the end of 2016, so you may or may not have information by the time you view this video.